Hello everyone and welcome to Blood and Hematology YouTube channel. This video is about morphologic changes in neutrophils. Conditions such as infection, inflammation, stress, or administration of colony-stimulating factors induce morphologic or qualitative changes in nucleus or cytoplasm of circulating neutrophils. Normal neutrophils contain 2 to 5 lobes that are separated by filaments. Finding 5% or more neutrophils with 5 lobes, or 1 neutrophil with 6 or more lobes, is considered hypersegmentation of neutrophils. Hypersegmented neutrophils can be seen in megaloblastic anemia, chronic infections, myelodysplastic syndrome, and rarely inherited. Composite image of peripheral blood smear from a patient with megaloblastic anemia showing hypersegmented neutrophils. A macropolycyte is about twice the size of a normal neutrophil. Its diameter is 15 to 25 micrometers rather than 12 to 15 micrometers. An analysis of its DNA content shows that it is tetraploid rather than diploid. The number of lobes present being increased proportionately. Macropolycytes have been observed in megaloblastic anemia, chronic infection, CML, and other myeloproliferative neoplasms, following the administration of cytotoxic drugs, antimetabolites, and granulocyte colony-stimulating factor. Hyposegmentation is defined as peanut-shaped, non-segmented or bilobed nucleus with the coarse chromatin of a mature cell. Hyposegmentation can be seen in Pelger-Huët anomaly, acquired or pseudo-Pelger-Huët anomaly. The acquired Pelger-Huët anomaly is common in myelodysplastic syndrome, acute myeloid leukemia, and primary myelofibrosis. Composite image of peripheral blood smear from a patient with Pelger-Huët anomaly showing hyposegmented neutrophils. Necrotic or necrobiotic neutrophils are cells that have died in the peripheral blood by apoptosis. They are recognized by their dense, homogeneous nuclei, which eventually become completely round or fragment into multiple dense masses. Infection is the most common cause of increased numbers of necrotic and apoptotic neutrophils. If blood is left at room temperature for a long time, a similar change can occur as an in vitro artifact. Composite image of peripheral blood smear showing necrotic neutrophils. Neutrophils with ring or donut nuclei are seen occasionally in normal subjects. They can be seen in chronic myeloid leukemia, chronic neutrophilic leukemia, myelodysplastic syndrome, and acute myeloid leukemia. Detached nuclear fragments, equivalent to the Howell-Jolly bodies of erythrocytes, are indicative of dysgranulopoiesis. They can be seen in HIV infection and administration of drugs interfering with DNA synthesis. Neutrophil nuclei may have projections that can have the shape of clubs, hooks, or tags. Increased nuclear projections can be a feature of myelodysplastic syndrome. Increased granulation of neutrophils, bands, and metamyelocytes, with granules appearing both larger and more basophilic than normal, is designated toxic granulation. In toxic granulation, the primary granules remain strongly aterophilic. Toxic granulation can be seen in various conditions including infection, sepsis, normal pregnancy, and following administration of granulocyte colony stimulating factor. Decreased number or absence of specific granules giving the cytoplasm a colorless appearance is designated hypogranulation or agranulation. Hypogranulation can be seen in myelodysplastic syndrome, myeloproliferative neoplasms, infection, and administration of colony-stimulating factor. Abnormal neutrophil granulation is seen in a number of inherited conditions including the Chidiac-Higoshi syndrome and the heterogeneous group of conditions giving rise to the Alder-Reilly anomaly. In Chidiac-Higoshi syndrome, the abnormal granules are quite variable in their staining characteristics. In Alder-Reilly anomaly, the abnormal neutrophils may have heavy granulation resembling toxic granulation, or there may be large, clearly abnormal granules. Dull bodies are pale blue or blue-gray cytoplasmic inclusions, single or multiple, often found towards the periphery of the cell. They usually measure only 1 to 2 micrometers in diameter, but may be up to 5 micrometers, and consisting of remnants of ribosomal RNA. Dull bodies are relatively nonspecific. They are associated with pregnancy, infective and inflammatory states, burns, administration of colony-stimulating factors, acute myeloid leukemia, myelodysplastic syndrome, following use of anti-cancer chemotherapeutic agents, and myeloproliferative disorders. Vacuoles are usually a feature of infection and generally reflect phagocytosis. Phagocytic vacuoles are frequently accompanied by toxic granulation. Cytoplasmic vacuoles can be induced by chemotherapy, poisoning, burns, autoantibodies, acute alcoholism, exposure to high doses of radiation, and storage in EDTA for more than 2 hours. Thank you for watching this video. If you liked this video, to give it a thumbs up and share it. Do not forget to subscribe to the channel if you still have not. You can click on the bell to receive notifications whenever a new video is uploaded.